All right, so without further ado, I will go ahead and introduce our guest speaker today. So again, this is on the topic of our nutrient deficiencies contributing to your pain. So today's presenter is Dr. Monisha Bhanote. She's the founder of Wellcula, is a quintuple board certified physician and a published author. She has expertise in integrative medicine, functional culinary medicine, and anatomic clinical pathology. After graduating from Binghamton University with dual degrees in chemistry and Asian studies, she earned her medical degree and completed training at NYU Winthrop University Hospital. She completed 3 fellowships and went on to study with the Andrew Weil Institute for Integrative Medicine in Arizona. Dr. Bhanote has additional training and certifications in mindfulness-based stress reduction, plant-based nutrition, Ayurveda, yoga for cancer recovery, and as a yoga medicine therapeutic specialist. Dr. Bhanote integrates ancient wisdom with mind-body science to provide a holistic approach to healing. Her interests include nutrition and the microbiome, the role of stress and inflammation in disease manifestation, applying mindfulness as a lifestyle practice, and disease prevention. And I'm now going to go ahead and hand off our presentation today to Dr. Bhanote. All right, so I can see you there, and then we have your slides all pulled up. It looks like you're on mute though.
Thank you. Thank you, Natalie, so much for that introduction. My name is Dr. Monisha Bhanote, and I'm going to be talking to you today about nutrient deficiencies and if they are contributing to your pain. So with that being said, let's start with this talk is being given on behalf of the Aging and Integrative Pain Assessment and Management Initiative in collaboration with Florida Blue Foundation. And you can see the contact information there for PAMI at Jax UFL. And Natalie has already gone over my introduction, so I'm not going to repeat that, but my website is drbhanote.com if you feel the need to reach out to me and ask me any further questions. I am a quintuple board certified physician with training in multiple specialties, and I combine all of that to really have a holistic approach to healing. I do have a presenter disclosure, and I have the following relationship to disclose. I am on the clinical advisory board for Wellcula Inc. And let's first start with what is chronic pain, because when people experience pain, they might have different experiences with that. So, and we know that pain is very complex. With that, chronic pain is pain that fails to resolve after an acute injury lasting more than 3 months. It's usually intractable and to conventional anesthesia, and also can become very debilitating. It can be caused by a lesion or a disease of the somatic sensory nervous system. It can be due to damage to the nervous system, as we usually see with neuropathic pain, or it can be due to inflammation, as we might see in arthritis. Like I said, there's many different types of chronic pain. You can have chronic primary pain, chronic post-surgical and post-traumatic pain, chronic neuropathic pain, chronic headache, orofacial pain, visceral pain, and musculoskeletal pain. But what is the integrative approach when we are talking about pain management? It is really multifactorial, and the goal of this is to restore function, health, and wellness. And the way that it's done is really by offering patient education, mind-body approaches such as yoga and mindfulness, acupuncture, lifestyle optimization with nutrition and exercise, and then of course dietary supplementations and botanicals where indicated. So when we start talking about the talk that you're here for today, are nutrient deficiencies contributing to your pain? One of the things we have to consider is, what is our definition of nutrients? Nutrients are substances that provide nourishment essential for growth and for maintenance of life. What could cause some of these nutrient deficiencies? Well, there's some common causes that we are exposed to quite often. One of them being a poor diet, and that is the standard American diet, which is high in processed food, high in sugar, high in animal fat, high in saturated and hydrogenated fats, low in fiber, and low in fruits and vegetables. The second cause could be diseases that are underlying and gland dysfunction. And thirdly, medications that might interfere with your body's ability to even absorb those nutrients, even if you are eating a whole foods diet. So with that, according to research, we are really, despite being well fed, we are undernourished Americans, and we actually have a lot of nutrient deficiencies with significant health consequences. There is a very large study that was done with the National Health and Nutrition Examination Survey, and it was found that both children and adults in the US are deficient in vitamins A, B6, B12, C, D, folate, and iron. And that's just really the beginning. So even though we have a lot of calories and we are eating quite a bit of food, the food that we are eating is not providing us the nourishment that we need for our body to function. With that, there is even a further breakdown of that. So nearly 1/3 of the US population is at risk of one vitamin deficiency or anemia. 32% have an insufficiency of B6 intake. 95% have inadequate vitamin D intake. And I'm sure you've been hearing more about vitamin D in the last few years. And then 61% don't get enough magnesium. And that is just really the beginning. We have other percentages with all the other vitamins. And these statistics really might represent a underestimation of the true scope of nutritional deficiencies because often we are not checking for these regularly.
Can I interrupt you there real quick, Dr. Bhanote? Can you check your speaker for me? I just had a couple people say that they felt like the volume might not be a little low on your end. I don't know if you have a speaker attached or a mic, attached to you, or if there's any way that you might be able to adjust that. And I'm not sure if you're wearing it. It just sounds like it might be hitting something.
No mic. It's coming right off of my computer. I can turn the sound up. Is that a little bit better?
It seems clear on my end, so I think that will probably work.
Okay. All right.
Thank you.
I just turned the volume up. Okay, perfect. Thank you for letting me know, Natalie. So the second item that I mentioned that can affect your nutrients is possible medical problems that you have. So if you have alcoholic liver disease, liver failure, kidney disease, chronic diarrhea, gastric bypass surgery, inflammatory bowel disease, Crohn's disease, irritable bowel syndrome, malabsorption syndrome, and pernicious anemia, all of these will make it hard for you not only to absorb the nutrients from your food, but also to metabolize those nutrients. So these are some of the medical problems that if you do have, you do want to talk to your physician to see is there something that can be addressed so you can make sure you're getting those nutrients in. Then after that is lastly medications. Okay, so medications that we often use to treat pain also can cause deficiencies. So some of the more common ones like Advil, Aleve, Excedrin, like the NSAIDs that we're familiar with, when taken for quite a bit of time in chronic pain, you might be taking them for many, many years, can lead to depletion of vitamin C, zinc, iron, B vitamin, such as folic acid. And the side effect of that is really impacting your cellular function. So you may experience a weakened immune system, an increased risk of infections, increased gut permeability and inflammation, possibly even ulcers. And then opioids, which is another one, can lead to deficiencies in zinc, selenium, glutathione, once again, all of which are important for your immune system and to prevent oxidative damage and to counteract oxidative damage, actually. Next is glucocorticoids. So sometimes in situations you might get steroid injections or steroid treatment. This can deplete magnesium, potassium, sodium, selenium, zinc, reduce calcium absorption. leading to weakened immune system, affecting your bone and cellular health and your muscle and nerve function. Additionally, steroids can interfere with that magnesium and vitamin D metabolism. And then lastly, the DMARDs, which are the ones that are used often for anti-rheumatic diseases. So they will lead to a number of deficiencies in the B vitamins and minerals with multiple systemic effects. What I recommend you do is if you have your phone, take a screenshot of this image because this is a lot of information here. And this is something worth talking to your clinician with to see, I've been on this medication, should I be testing for these? Can you test for these? That would be really helpful for you to know. Then with this, really, what does the role of diet and supplements play in pain management? Well, first off, dietary intake can affect pain by modulating systemic inflammation and oxidative stress. Oxidative stress is the reaction that's happening in the body that contributes to all of our chronic diseases. So we definitely want to fight that. Then diet can also affect the nutrients and cellular functions that I've already mentioned. Whole food diet interventions are associated with reduced non-cancer chronic pain scores. So when you're eating more whole foods, we do see that you have lower pain, chronic pain. Some of the diets that have been examined are a vegetarian, vegan, weight loss, or peptide diets. Then those were associated with improved pain, as well as a vegetarian and Mediterranean diet are associated with significant reduction in pain intensity. So with that, what are all these vitamins and minerals that are necessary for cellular health? Well, let me just say there is a lot, and this is only a small list. We have about 8 B vitamins. We have the fat-soluble vitamins D, E, A, and K, and then we also have vitamin C. All have a role in the body, and we all need to have a certain amount and certain balance with them. Yes, I see that somebody put in a question there that GERD medications is not listed. You're absolutely correct. That is one of the ones that causes multiple deficiencies. And I did not list that only because that one is not used for chronic pain necessarily. It's used more for reflux symptoms, which may be associated as a side effect of pain. But yes, this is correct. So thank you. And then there's also minerals for cellular health, right? So those are magnesium, manganese, iodine, iron, calcium, chromium, potassium, zinc. Overall, where are you getting these ingredients from? You're really getting them from food. So depending on what kind of food and what kind of dietary plan you're following, you could have adequate amounts or you could be deficient in these. It would be hard to say without testing for them. But let's talk about some of the big vitamins that are linked with pain and the ones where we have studies for. So vitamin D is a prohormone. Even though it's called a vitamin, it is a prohormone, and it is found in every tissue in our body and has that our body has these vitamin D receptors to receive vitamin D. So in our bones, muscles, immune system, brain cells. Vitamin D deficiencies are quite common in individuals with chronic pain, fatigue, and muscle aches. As I already mentioned, 95% of people can be vitamin D deficient. Some of the symptoms you might experience is fatigue, bone pain, muscle weakness, muscle aches, muscle cramps, back pain, are some of the common symptoms that you see. They're not all of the symptoms, but they're some of the common ones. Vitamin D3 is the most bioavailable form. It's quickly absorbed and rarely found in foods. So some ways of getting vitamin D is sun exposure. So you want 20 to 30 minutes per day of sun exposure, exposing your arms and legs without sunblock because sunblock will block that. And then your other best choice is really supplementation to increase your levels. Now, researchers at Mayo Clinic published a study showing that patients with inadequate vitamin D levels who were taking narcotic pain drugs required 2 times as much medication to control their pains as did people with adequate D levels. So that's something to keep in mind, depending on the medications you're taking, that maybe you can consider reducing your dose of medications by optimizing your vitamin and mineral levels. So how exactly does this happen? So vitamin D is synthesized in the skin. There is, as I mentioned, vitamin D receptor. It's expressed in the nerve cells that are in the skin. And then what they do is they travel via the dorsal root ganglia through the spinal cord, brain, and intestine. Nociceptors from these specific areas respond to environmental stimuli such as thermal, mechanical, chemicals, and then there's an electrochemical signal that is issued. And that's how you're experiencing pain. Now, we also have those in our gut. So where we can experience intestinal type pain. So that's a visceral type of nociception. And visceral pain is something that's going to come from your internal organs. So like I said, people are going to experience chronic pain in many ways. It might be musculoskeletal, it might be visceral, it might be neuropathic. So many different avenues of experiencing pain. And the receptors that are in the intestine actually are very, very sensitive to pro-inflammatory signals and to chemicals released. So something to keep in mind that there is multiple things going on when we are discussing a potential pain pathway and how vitamin D can impact it. Then there was a rather large meta-analysis of over 55 randomized controlled trials with over 13,000 subjects. And they wanted to look at the symptomatic efficacy of pharmacological treatments for knee osteoarthritis, which when you get up to the age of 50, you start feeling that joint pain and you possibly could have osteoarthritis. So in that review of those 55 randomized control studies, there was 4 that were specifically randomized to vitamin D. And from the results, you can see here that vitamin D actually fell in 3rd in the connection between how it can be therapeutic and efficacious for pain. And then it fell in 4th for function. So that's pretty important to know, because if you see here with all the different drugs that were tested, right? So looking at prednisone, looking at naproxen, let's see, chondroitin sulfate, diclofenac, some of the different things that I'm sure if you're using any of these pain medications, you're familiar with. Vitamin D actually was towards the top. And then the same thing over here for function, it fell above naproxen and chondroitin and glucosamine, some of the things you would think about using more for joints, and even paroxycan. So very commonly used medication. So do keep that in mind. So I'm just going to give you a brief, there is different studies for different vitamins. I just want to give you the key ones to really look out for when it comes to pain. And these are the ones I want you to think about talking to your clinician about. So B vitamins also fall in that category. Now, B vitamins are important for myelin sheath. It protects your nerves. And like I said, neuropathic pain. So we want to make sure our nerves are protected. So with B vitamins such as thiamine, B1, peroxidine, B6, B12, they have proven to be effective in treating various painful conditions such as lumbago, sciatica, trigeminal neuralgia, facial paralysis, optic neuritis, and as a pain reliever, whereas B3 can relieve osteoarthritis discomfort and improve joint flexibility, reduce inflammation, and reduce the need for these anti-inflammatory medications. And then B12 is also beneficial for neurologic pain that can present with tingling. Some of the food sources of these that you can get B vitamins from is from seafood, legumes, leafy greens, fortified cereals, and nutritional yeast are some sources of this. So what do the studies really say about this? Like where can we find some research around some of these B vitamins? Like I mentioned, there are 8 B vitamins, so that I'm not going to go over all of them, but I'm going to give you some of the more convincing studies. So B12 was used as a treatment for peripheral neuropathic pain. And there is a systematic review that included 24 studies. 16 of those were randomized controlled trials, 5 single arm interventions, 1 randomized, and 1 phase 4 clinical trial. And what the published evidence describes is that B12 as a treatment for pain in peripheral polyneuropathies, this was addressed. And there is level 3 evidence for the overall support for the use of B12, either as a monotherapy or in combination with other therapies for neuropathic pain. With many of these supplementation trials and food trials, we have even less of that. The limitation is really multifactorial in the fact that we end up having shorter follow-up duration as opposed to medications, which are followed up looking for one single side effect, looking for one treatment avenue. Vitamins and minerals work better in balance and in conjugation. They all support each other in chemical reactions, so they work slightly differently than medications would, where a medication is used specifically for a specific symptom, whereas vitamins, minerals, foods are used for the functionality of the overall body. Then there was another double-blind controlled study that was done on diclofenac, using it as a monotherapy alone or using it plus B vitamins in 372 subjects. And the ones who used this pain medication with the B vitamins, the results had superior relief even after 3 days of treatment. Then the next one I want you to consider is magnesium. So magnesium is the most abundant mineral in the body. It is required for over 300 biochemical reactions. And it happens to be one of the ones that I find most individuals are deficient in the local area. So I imagine nationwide that is also the case. It is required for protein synthesis, muscle and nerve function, energy production, and blood pressure regulation. Some of the symptoms you might experience is tingling, cramping, numbness, muscle cramps are some of the more common ones. And as we get older, our magnesium intake decreases because our diet essentially changes too as we get older. Benefits of magnesium therapy have been reported in patients with neuropathic pain, in diabetic neuropathy, in fibromyalgia, in headaches and acute migraine attacks. Sources of getting magnesium would be dark leafy greens, nuts, seeds, beans, whole grains, avocados, bananas, kelp noodles. And one of my favorite forms of magnesium is dark chocolate. So yes, you can eat dark chocolate and get some good magnesium, but everything in moderation. Then there are multiple different types of magnesium to consider, depending on what you're trying to address. Some of the best forms are magnesium glycinate, malate, and citrate. If you're addressing it maybe for headaches and migraines, you may want to consider a different form, one that will cross the blood-brain barrier, such as magnesium L-threonate. So like I said, you definitely want to work with your doctor on making sure you're getting the right one. and the right dosage when it comes to any of these supplementations. So where are the studies around magnesium? So there is a double-blind randomized controlled trial that lasted 6 months. It was only 80 patients, but it was 80 patients who had refractory lower back pain. All of these patients were given gabapentin, amitriptyline, and ciloxifid twice a day. And then the intervention was that some of them received IV magnesium and some of them, and then after that, received oral magnesium. Both groups had significant reduction in pain in 2 weeks. However, the one in the magnesium group, that pain reduction lasted even longer than those 2 weeks. It lasted up to 6 months. And something to keep in mind, magnesium deficiency is linked to elevated C-reactive protein. That is a blood marker that your doctor can test for. The important thing to know about magnesium is it blocks pain transduction and the central pain sensitization, downregulating the receptors that are receiving the pain. Then there was another recent paper that came out looking at 81 randomized control trials with over 5,000 people on magnesium for treatment for pain. The conclusion was that the efficacy of magnesium in reducing pain is only modest. The challenge was that there is not enough studies, even though this might look like there's a lot of studies. Compared to the number of studies that are done on drugs, this is not that large. And really what we need is more clinical trials to achieve sufficient level of evidence. The thing to understand is, even though we might not have these larger trials, when you are taking these via food, there's not going to be the side effects that you're going to commonly experience with medications. When you're taking them with supplementations, usually the side effects are less than a medication, and depending on what your deficiency is, and that's why I would say you want to test, not just guess what you're taking, how you're going to take it. So you're getting the right dosage before saying it does or does not work. Another important factor is amino acids. Now, amino acids are your building blocks of protein and a component of neurotransmitters, muscle, cell, cartilage, bone, and tissue. The body's 3 primary pain modulators appear to be the neurotransmitters endorphin, serotonin, and GABA, and these are all produced by amino acids. Some of the common signs we might see with amino acid deficiencies is muscle loss, increased anxiety and depression, difficulty concentrating, digestive disturbances, and a slow healing time. And research and practice have found that an increased take of amino acids can affect the 3 key pain modulating neurotransmitters. And you can notice this benefit even within a few days. What are some of these amino acids? This might be methionine. That is very critical for those with arthritis to help relieve pain and stimulate cartilaginous tissue. Arginine is an component of collagen. Sources of amino acids, think about where you're going to get protein from. Now, I always like to give you options for more plant-based sources, so we're not also increasing the inflammatory pathway, but we're focused more on the anti-inflammatory pathway. So those would be lots of nuts and seeds, such as chia seeds, sunflower seeds, almonds, avocados, figs. Quinoa is a source of a complete protein. Then omega-3 fatty acids. So this is one of the essential types of fat used in metabolic processes. It helps to reduce inflammation in musculoskeletal conditions and relieving pain. It can help stimulate the development of cartilage for joint repair. It can increase mineral absorption and is effective for migraines, back pains, and arthritis. Well, when you are eating the standard American diet, which I previously mentioned earlier, that diet is higher in pro-inflammatory fatty acids as opposed to the omega-3 anti-inflammatory. So yes, your dietary intake will affect your pain threshold. When we don't get enough omega-3s, we might experience fatigue, poor memory, poor circulation, and inflammation. And some studies have found that the consumption of higher amounts of polyunsaturated fatty acids, the omegas, have lower pain scores. And the reason they have lower pain scores is because they can inhibit the arachidonic acid pathway that leads to the decreased production of the inflammatory cytokines. Now, some of those medications that you might be taking, that's what they're doing as well. They're trying to decrease the release of these inflammatory cytokines. But in my opinion, eating some good food is a lot easier way of trying to balance that than increasing your dosage of medication. It also shows that it inhibits pain signaling by increasing the endorphins and resolvins that actually make our body feel good. So sources of omega fatty acids would be things like salmon, algae, walnuts, flax seeds, chia seeds, and soybeans is some of the sources. Now, what does the research say about using fatty acids? Well, the different fatty acid types have a distinct effect on osteoarthritis signs and symptoms, and this has been observed in both in vitro and in vivo studies. As I've already mentioned, it suggests an unfavorable effect of saturated fatty acids and the omega-6 with that increase of pro-inflammatory and pro-apoptotic markers. But you guys don't need markers to know how your body feels. You will feel it. Whereas omega-3 polyunsaturated fatty acids were associated with a reduction of inflammatory and degradation markers, even in the chondrocytes and the synoviocytes, which are two of the types of cells that you will find in your joints. And both in animal and human intervention studies, omega-3 polyunsaturated fatty acids were shown to exert a beneficial effect on osteoarthritis symptoms and structural abnormalities. Now, is that all? No, we can still do a little bit better. So polyphenols. Now, polyphenol is not necessarily a vitamin or mineral, but what it is a class of compounds that is found in many plant foods that includes things like flavonoids, phenolic acids, ligands, stilbenes, and there's more than 8,000 different types. Now, the only way to get polyphenols is through eating plants. They have a unique anti-inflammatory effect in the body and the plants themselves. What happens is these polyphenols will upregulate, I know this image, this picture looks quite complex, but from a oxidative stress pathway, the one that contributes to a lot of these chronic diseases that I mentioned, what polyphenols can do is upregulate over here this NRF2. And what that does is, in turn, it upregulates more antioxidants and more detoxifying enzymes, specifically like glutathione-based ones. The other thing that it can do at the same time is it can inhibit this NF-kappa beta. And why do we care about that? Well, this is considered the master switch of inflammation, as it is responsible for hundreds of chemical reactions involved in the inflammatory response. So when you think of the inflammatory response, it is really multifactorial here. So with that, some of the polyphenols that you may see both in supplement form, but you can also get them in food form, are curcumin, so turmeric. What it does is that one acts on that NF-kappa beta. So over here, it acts on that. It inhibits it. It also acts on your tumor necrosis factor alpha and your COX pathway. Resveratrol, which is found in grapes and peanuts, will also inhibit that master inflammation, NF-kappa. And quercetin, which is also found in apples and onions. What that does is it's going to reduce all those inflammatory cytokines like interleukin-1, 6, IFN gamma, and TNF alpha. So you can see that by eating different foods and whole foods and lots of plants, you're going to be able to get a lot of these compounds. So what is some of the studies around this? I just have a limited number of studies here I want to share with you. So one was 6 studies comprised of 4 clinical trials and 2 observational cohorts. The follow-up time ranged anywhere from 3 weeks to 7 months. The dietary patterns that they observed were 4 were vegetarian and 2 were vegan. And what they found in this review is that plant-based diets are associated with increased serum levels of polyphenols. So those are those carotenoids, lycopene, lutein, quercetin, camphorol, all those ones that are fighting that pathway of that oxidative stress that I just showed you. They also decreased serum cholesterol and fibrinogen. They also decreased BMI, which with decreasing your BMI can have a compounded effect with decreasing your osteoarthritis pain because you have less pain, less weight on that joint. And the interesting thing in this studies that we found is that we had a decreased pain at rest. And when the individuals reintroduced animal foods, that effect disappeared, which I thought was pretty interesting. Additionally, we had reduced morning stiffness and somatic pain intensity. So you can see here, I have an entire color rainbow of foods. So when you're thinking of polyphenols, think about the colors of the rainbow, your reds, oranges, yellows, greens, blues, violets, all these different foods, and making sure you're getting a nice variety of all of these. Another study was done on a randomized double-blind crossover trial that lasted just about 12 weeks. Small study, but it was done on individuals who had knee osteoarthritis that was confirmed by X-ray. And what they found in these individuals is that an intake of 50 grams, and that's only 2 ounces of strawberry daily, reduced their constant, intermittent, and total pain. Plus, it also reduced those pro-inflammatory chemicals that I was talking about, the interleukin-6, tumor necrosis factor, alpha interleukin, and MMP. So really good. Strawberries contain a lot of those polyphenols. They contain catechins, epicatechins, quercetin, camphorol, and iligac acid. So you can see there's so many chemical compounds here that you can get more of these from food than necessarily isolated supplements. So there's a plus and minus here, right? When I think of supplementation, I think of it as exactly what it is, a supplement in addition to eating a well-balanced whole foods diet. You can't replace the chemical reactions and synergy that happen from eating that way. And then, interestingly enough, some of the latest research. So now this is much newer, and we're just learning more and more about this. But probiotics, how can they affect the pain pathway? So probiotics are live microorganisms that are intended to have health benefits when consumed or applied to the body. There is strong evidence that the gut microbiota plays a crucial role in abdominal pain, in opioid tolerance, headaches, inflammatory pain, and neuropathic pain. Some of the sources of food for probiotics would be your fermented foods like kefir, kimchi, miso, sauerkraut, kombucha, yogurts, and then of course, supplementation. The thing about probiotics is that what's happening is that we are learning more and more about the connection between our gut-brain axis. So when, and there is a bimodal communication, which means what's happening in our gut is communicating back to our brain, and what's happening in our brain is communicating back down to our gut. And as we're learning more and more about that, we're learning that there is a crosstalk happening. And that crosstalk is a combination of metabolic, neural, immuno, and endocrine signaling pathways. So looking just at this one image here, you can see that when it comes to neuropathic pain specifically, that there is pro-inflammatory mediators from your immune cells and your macrophages that are communicating via your gut, via external factors, via maybe toxins that you might be exposed to, via medications that may enter and increase inflammation in the body. It's also communicating via the nociceptor excitability. And then lastly, it's interacting with our glial cells. And glial cells are the cells in our brain that become hyper-responsive and hyper-reactive. So having a healthy gut will have you have a healthy brain, which will have you respond to pain and tolerate pain and not have as much pain. So one of the things to look at is how is your digestion when we are dealing with pain. That is one new thing that we don't often talk about when it comes to pain because we're so focused on that musculoskeletal, that joint, but there is this pathway and this connection I want you to be familiar with. Now, what is the underlying therapeutic strategy when we are talking about neuropathic pain and targeting it through microbiota? Well, there's 5 things to consider here. It's not just the probiotics. You may want to consider probiotics and possibly antibiotics. There is fecal microbiota transplantation. So if depending on the state of your gut microbiota, and that changes based off of what you eat. That changes based off of your medications. That changes based off of your exposure to toxins. And then also possibly a low FODMAP diet may be beneficial for some individuals. Now, this diet is not meant to be on for a long time. It is a temporary eating plan really to heal your gut and help absorbability for some time. We've already talked about vitamin D supplementation, and there is an aspect of emotional management when it comes to healing the gut and addressing neuropathic pain. So with this, what are some of the takeaways that we can take away from listening to this? One, we, as a population in America, we need to increase our consumption of whole foods. And that would be mostly vegetables and fruits. You'd be surprised that most people are eating maybe 2 vegetables a day, one of them being white potatoes, right? Ideally, I would like to see individuals eating up to 10 fruits and vegetables a day. I'm not going to ask you to get there tomorrow, but that is a good goal to get at to increase your level of vitamins, minerals, polyphenols, all this stuff I've been talking about. Secondly, we want to decrease our consumption of inflammatory processed foods that we find often in the standard American diet. Third is your body is meant to move. So physical activity reduces chronic pain by building muscle strength and flexibility, reducing fatigue, reducing pain sensitivity, and reducing inflammation. Plus, physical activity also releases a number of neurochemicals which can make you feel a lot better and decrease your pain. So also taking a look at your sleep quality, studies find that lack of sleep impairs the brain's natural mechanisms for relieving pain. So making sure if there's anything you may be able to address when it comes to your sleep quality, reducing any artificial light before you go to bed, making sure that there's a nice cool room so you're not disrupted in your sleep. And then also test, don't guess. Laboratory testing can help you identify these nutrient deficiencies. And what works best is targeted supplementation. What I mean by targeted supplementation is a testing, and then if you're deficient, supplement that with food or supplements. And lastly, adding an integrative and functional medicine doctor to your healthcare team can be beneficial in helping you address these issues, as they're usually trained in this sort of in-depth testing and supplementation. And this is not as a replacement to your primary care doctor or your pain doctor. This is really in collaboration as part of the team to help support you overall. Now, with that, is there any resources? I did want to provide you with one resource, and that is wellcasa.com. And this is a web-based application. So on the internet, what you can learn about is you can go in there and search for whatever medical condition you might have, joint pain, osteoarthritis, bone health, osteoporosis, whatever you're experiencing. You can type in there and you can see what is the research behind different supplements. Is there any research? Is there sufficient research? Is there insufficient? Should I use this? Should I not use it? Secondly, the other thing you can do is you can do an interaction checker. And with the interaction checker, what that helps you do is to see, all right, if you're on a medication, is that medication going to interfere with the supplement? Is the supplement going to interfere with the medication, and vice versa? So that's always important to check. You can also provide this information to your medical professional and to your caregiver to help you to track this. Additionally, you can track all your medications and supplements in this online application, and you can take notes and journal and see how well you are feeling based off of taking it. And the best part, really, what I like is that the research is already there for you. All you have to do is click on it, and it makes it super easy with giving you a green, yellow, or red, telling you it's green is a go, it can be helpful, red is a no, we do not want to use that. So this is an easy way for you to kind of self-educate yourself and see, is this going to be helpful? And then lastly, I wanted to let you know, I can always be reached at my website at drbhanote.com. And I do have a book coming out later this summer. It's called The Anatomy of Wellbeing, where you're going to be able to get an even more in-depth look at how the body functions and how you can really utilize so many different things to make it function even better. And thank you, Natalie. That's the end of my presentation, unless somebody wants to see some recipes. I've got some quick recipes to share, but it looks like we've got quite a bit of questions in the chat, so I want to make sure we get those answered.
Yes, yeah, we definitely have a number of questions. So before we kind of continue on, we'll get some of these addressed, and I'm going to try to chop these up by vitamin for questions that are related to vitamins specifically, and I'll work our way down from those that were submitted earlier on. So we'll start with questions that are related to vitamin D. So someone had submitted a question asking, would you recommend getting a vitamin D level lab test before starting vitamin D supplementation? Absolutely,
100%. So with vitamin D supplementation, so vitamin D is a fat soluble vitamin, which means that if we take too much of it, it doesn't leave our body, it stays in our body. So we don't want too much of that. So one way of testing that is you can do a simple blood test. It can be done in many places, LabCorp, Quest, all of the standard places will do this blood test, and it is usually covered by insurance. Secondly, when you do take vitamin D supplementation, you want to base your dose off of one, the deficiency, if you have one, two, the level that you want to get at. Three, also, when it is calculated based on your current intake and your weight. So your friend's vitamin D dosage might be different than your sister's. So I always recommend to test it. It is a very simple test to do.
Thank you. And someone asked, we can kind of, I guess, make this a little bit more broad, but what if vitamin D3 makes you sick, or for that matter, anything that you're taking? Can you comment a little bit more about that?
Yeah, so that's a little hard to answer without context of how it's making you sick. But so one, like I said, I always recommend eating more foods than supplementation necessarily, unless you are deficient. But then again, sometimes it's hard to eat this many foods or we don't have access to it. So supplements can really come in handy to fill in the gap. As for if it makes you not feel well, there's something to look at there. Sometimes some individuals don't do well on certain B vitamins because they have a genetic mutation That might affect how they respond. Some people will do better on liquid forms for absorbability than capsule forms. So there's multiple factors that go in there. So without knowing the exact situation, I think definitely talk to your physician about this. Just kind of like, let me give you an example. So we live in a world of not only polypharmacia, right? So we've got a dozen or so medications that individuals are on. We also have the same situation, unfortunately, with supplementation, right? So when I have people coming to my office and I say, bring everything with you, and we line up like 20 supplements, 19 of those 20 supplements usually end up in what I call the supplement graveyard, because either one, they're not a therapeutic dose, two, they might have fillers or something that is affecting other parts of their body that we don't want, or three, they didn't think about how they were interacting with their medication. So it is its own kind of appointment that you would want to have with your physician to make sure that whatever you are taking, and that includes anything down to even protein powders and things you might pick up at the store that you think really aren't supplements, but they are. So yes.
Thank you. And along with vitamin D, should calcium be taken with vitamin D?
Yeah, so this is where it comes to, all right, what are the vitamins that you are necessarily deficient in? Calcium you can generally get with food, depending on the age, the menopausal status, the bone status, if you are osteopenic versus osteoporotic. Many things go into that. So, and it also depends what you're treating, right? So if you're using vitamin D for immune health versus vitamin D for helping your bones, it's going to change.
And moving into vitamin B, so this might be a question that has to be a little bit more tailored, but in general, how much of the recommended dose of B12 would you need to take to find pain relief, or is that really individualized by the person and their need?
Yeah, that's going to be individualized by the person based off of what their food consumption of foods that they might be eating for B vitamins. Now, if you are vegetarian or vegan, you might not be getting as much B12 as somebody who eats a lot of meat. So that would have to be tailored. Then secondly, also, you would want to look at what your current levels are to see how deficient you are, if you are deficient or if you're just on the lower end. And then also you would want to look at what kind of pain we're talking about. So yes. Multifactorial.
And then moving into a few about magnesium. So can magnesium be absorbed through the skin? Is there a spray or lotion or other forms that comes in besides oral?
Yeah, absolutely. So magnesium can be absorbed through the skin. And if you think of Epsom salt baths, that's one of the best ways to get magnesium through your skin. What it does is it helps your muscles relax, so it can ease that muscle tension. And it also helps you sleep better. So that is a great way to get it through the skin, Epsom salt baths. And I do recommend, if you start doing Epsom salt baths, to start slowly, maybe once a week, and make sure you're very well hydrated when you do take them, because there is a little change and balance in the water and the chemicals in your body when you are absorbing nutrients this way.
And then another one on magnesium. I think you had mentioned a type that is known a little bit more for migraines, if you don't mind repeating that.
Yeah, so one of the magnesiums that crosses the blood-brain barrier is magnesium L-threonate. So the other ones generally don't. So anytime we're dealing with issues with migraine, maybe sleep, like more in the brain aspect, that is one that I will use.
And how would you know if there were side effects of maybe too much magnesium? Are there specific things that you might look for?
Well, so I do think it's important that when you do start taking any new supplementation, but I've already mentioned multiple times to test for it. You don't want to take things that your body does not need, because excess of something is also not good for the body. that can also work in a way where it doesn't help the bodily function. So excess is not good and too little is not good. It's kind of the Goldilocks phenomenon, right? Too little, too big, right? So you kind of want to find out, and that's where that personalized and really precision medicine comes in, because we're really looking at your specific needs based off of your lifestyle, how you're living your life, what you're eating, and not only what you're eating, but is your body absorbing the nutrients, right? So you might have the best diet in the world and you're not able to break down those nutrients into the vitamins and minerals because your gut is not as healthy as it could be. So there is a lot that goes into it.
All right. And then this is more about kind of types of fruits and vegetables to consume. So can you speak a little bit more to canned fruits and vegetables versus frozen versus actual, produce that you might find in the produce section?
Yeah, so when it comes to eating fruits and vegetables, you want to try and stay seasonal. So whatever's in season is going to be the freshest, plus it's going to be the most cost effective. Secondly, if you're in a place where it's hard to get fresh fruit, like you don't have a farmer's market or some of these more health food stores around, one of the best places to look is in your freezer section and looking for frozen food. I mean, you can find bags of frozen fruits and vegetables that have been frozen at their peak nutrition and ripeness and taste. Plus, they've already been chopped for you. It makes it really easy for you to consume more of them. They've already been cleaned. So I definitely think frozen. I would try and stay away from canned as much as possible, because canned is usually floating in some kind of liquid, and that liquid might have added sugars that aren't necessarily going to be beneficial, or added salts, which will not be beneficial to the body. So I would refrain from them. And plus also cans, depending on the lining of the cans, can contain chemicals which could be harmful to the body.
All right. And then this one's a little bit more specific about substance use disorders. So do you find, or does the literature show that there are any identified nutrient deficiencies associated with substance use disorders? Or again, is this kind of something related to individuals specifically?
Yeah, so it is related to individuals, right? So, and that's going to depend on what substances we're talking about, right? So are we talking about substances like opioids, which I already showed you the slide that shows you the number of deficiencies from being on chronic long-term opioids? Then if it's due to alcohol, you're also going to have a number of deficiencies because your liver is not utilizing what your other things that your body is taking up. It's not able to create that. And then drugs will have its own effect, right? So it's really going to depend, but yeah, nutrient deficiencies with substance abuse disorders, it's worth checking because they can be helpful.
Thank you for that. And then someone was asking about resources for finding filler-free supplements, or maybe how would you identify that when you're looking through bottles, or is there website resources, et cetera,
Yeah,
for that?
excellent question. So definitely you want to read the back of the bottles, and you're going to see that there's going to be a lot of words on there that you don't understand. That is why I gave you that one resource of La Casa, because the purpose behind that resource is really to, we've already done the hard work for you and the research, and we're picking out different supplements based on their efficacy, based on their least number of potential fillers. They're usually wheat-free, gluten-free, soy-free, alcohol-free. So we've already done that kind of hard work for you. So that is one resource I would say. I know going to Dr. Google can be a little bit overwhelming. So I think going and playing on this website a little bit and kind of exploring it is going to be worth your time.
Thank you. And those are all the submitted questions I see really pertaining to our talk today. So if you have anything else that you want to share before we wrap up, we can do so, but otherwise it's just a little bit after 1. So we appreciate everyone who's stayed with us thus far, and Dr. Bhanote for your time. So any concluding remarks, we'll go ahead and do those now.
Okay, perfect. Thank you so much, Natalie and University of Florida, for inviting me to do this talk. I sure hope you learned a lot. And like I said, talk to your doctor about these things. Whatever you learn from here, write it down. Make sure the next time you go for your doctor's appointment, ask them about it. If they don't know about it, ask them to reach out to me. I do work with a lot of doctors because not necessarily all doctors are trained to understand this. So, and I'm also available, like I said, at drbhanote.com, and I do see patients online.
All right, thank you so much. And then for those who are still on here, yes, you will receive the recording and all of the resources and information from today's talk. So we do appreciate you hanging in there. We'll get that shared out as we wrap up, and we hope everybody has a good afternoon. So thank you for staying with us. Bye.